Hello, I'm Bishop Watkins, and welcome to our very first That Senior Show. I'm your host and the creator of That Senior Show. In the last 15 years, I've been thinking about a show about seniors. And now we're finally getting around to producing this show. We want to hear from you. We want to hear from seniors. That's what this senior show is about. It's all about seniors. We will be exploring every aspect that affects a senior and the concerns. In our upcoming shows, we'll be talking about finance, relationships, scams, sex, aging, caregivers for Alzheimer's, and living not just an existing life, but living a life, and not just the twice a child life as the Bible speaks of, and much more. Today, we're going to explore 3 key concerns for seniors: housing, Medicare, and health. We'll be discussing some things about housing. And seniors are concerned because today it's a hard thing because people don't have a place to live. In California, it's a very hard place to live, very difficult. People are moving to Arizona and other states. But the government is kind of looking out for that, especially in Oakland, California. We have our county and are concerned about us. And right now, housing is one of the most important things that's on our agenda. We have a lot of, I would say, not homeless people, unhoused people. And the churches are working very hard, very diligently to work with extra space on their parking lots. They can park from 7 in the afternoon to 7 a.m. in the morning. And then they get their parking lots back. But housing is what we're concerned about. You know, anyone can chime in on this anytime they want to, because I really want to hear the views from Beverly and Iris, that dealing with them, and I don't know whether you come in contact with a lot of that, Iris, with the housing situation.
Yes, I do.
Beverly, you do?
Yeah, and mostly, along with what Ruben said, is that affordable housing is just about vanished due to gentrification. Yes. So finding a place that they could afford in safe neighborhoods that have the kind of features that they need in the homes is really, really hard to do.
It's very difficult.
And it's closed out so many places. They're just struggling with it. I like the fact that you said the churches are doing something, but we're talking about the tail end after they're homeless.
Yes.
So also what we want to include in the conversation, what do we do to prevent some of that homelessness? Yeah.
Me personally, I have a feeling that the city is created a lot of this. The city and these all these large high-income development. The city should have put restraints where the income, the buildings regulated was equivalent to what the people in the neighborhood live in. Yes. But that has been not even double, I would say like 5 times of what the average Oakland resident is used to paying.
Well, a lot of that is our government. And when people don't vote, you vote in, then you get a lot of different things and a lot of different flavors come into the picture. Like, for instance, you'll give away your cities if you don't watch it.
You're already giving them away already.
Already have.
Through the gentrification.
That's right. And so what happens is that we have to vote, we have to watch, and we have to really research about the people we put in charge.
Yep.
If not, then what happens is we end up with a situation like we have right now. Oakland was the last place that Silicon Valley and the Googles and all, we were the last.
The Bay Area.
Yes, right here in Oakland was the
East
last.
Bay.
East Bay.
They already got San Francisco.
They got San Francisco. They went to Fremont. They went to San Leandro. They went Hayward. We were the last.
You know what I mean?
I want to go back to the voting thing, what you said, because more education needs to happen about voting. What are we voting for, not just for a president, We need to be paying attention to the senators, the people who write bills and legislation that
Yes.
support the elderly. And if they're not on the ticket, they don't even consider that as part of their platform. That housing takes into regard that elders are on a fixed income.
Yes, they
That's
are.
right.
So raising the rents is going to force them out.
It's it. It
And
will.
along with what Iris said, that they're building these developments that they can't afford anyway. So
Yes.
we need to figure out who the people are that support, and those are the people we need to vote down ballot,
And
not
you
just
know,
at the top.
I agree with you because I've seen so much of it. I worked for the city as a building inspector, and I saw a lot coming in. Even when Jerry Brown came in, I told one lady, I says, "Don't sell your property." I was making an inspection at her house, and it was 1999, and I said, "Don't sell your property. Wait for a bit. Sell it in a year." She sold it anyway. The guy who bought it, Jerry Brown came in. The guy who bought it, 6 months later, he sold it for 3 times of what he paid for it.
Yeah.
All he had to do was just wait.
But that also leads into another subject too, with the banks using the reverse mortgages
Yes.
and to steal people's property from under them. They're taking the family's legacy away. They worked, in the 50s and 60s, they
I'll
worked to buy a
agree.
house, and then now the children are growing up. The 80s, a lot of people got displaced, per drugs, a lot of that, especially in the low-income neighborhoods. And then so now the people are trying to come back now and try to save their families' houses, and the bank is cheating them, telling them, "We'll give you this money to fix your house up," and then when the mother dies, the property goes back to the children. It doesn't.
And that requires some education. When should you start preparing for senior life? And it shouldn't be at 50.
Yes.
It's like someone said to me years ago, Vietnam kind of ended my marriage, if that makes any sense to you. So I was being very careful, as most of us are, to have sufficient insurance for my children in the event of anything happens. Yet I was told at a certain point when my children are self-sufficient, some of that money there needs to be enough money to bury me, but then that money needs to be moved over for where I'm going to be housed, like assisted living or whatever I can anticipate I may need at a later, depending on my health,
For aftercare.
my
So-
my aftercare.
Yes.
And that's another piece of education that should be available to seniors.
But also your burial fund too.
Okay, we're going to take a break right now, and we're going to come back with our first guest. I want everybody to meet Norma Ferris Taylor, and we also have a new co-host, and he's not new, but he's come in. Is his segment set in, and that is
Mark Peterson.
Mark Peterson. But I have a question. What do seniors need to do to maintain? But first of all, before I do that, tell me about the black nurses.
Oh, the Black Nurses Association
Yes.
is made up of professional nurses and LVNs, and we have been around for about 50 years, a little over 50 years. Wow. We came together in the late 60s, and we really want to promote nursing, especially among women of color and young women of color. And so we do a lot of mentoring, scholarships. We actually go out in the community and provide community health fairs. We have instructional and educational programs that we provide also for the public and for nurses. So
That's
we've been really a long, long time, and I appreciate you even inquiring about us.
I want to know, what can seniors do to maintain their mobility?
Okay. The way I'm going to answer this question is, first of all, it's really something when you realize you're a senior.
Oh.
That's big, because it takes a minute for us to really realize that
Yes.
we've reached that.
It does.
So that's the first thing, just accepting the fact that now you're in a different role.
Yes.
But I think a lot of the challenges that seniors face is, of course, health, the health issues.
Oh, very
And
much so.
if you haven't really done a lot in your early years, you begin to feel it later on.
Yes, you do.
Of challenges, like things that come around your food,
Yes.
the food choices that you've made. Later on, we have a lot of seniors and a lot of people actually coming. They have diabetes, and that is a real challenge for
Yes,
our
it is.
seniors we have the challenge of hypertension, which is also is a very big issue in the African American community.
Blood pressure too.
High blood
Hypertension,
pressure
hypertension,
is
yeah.
hypertension.
Yes.
And hypertension causes kidney disease, it causes strokes, it causes heart attacks. There's so many things that are associated with that. But believe it or not, or if you haven't heard, that oftentimes the hypertension is also connected with the diabetes.
Yes.
So that's kind of like a double whammy.
A double whammy on
And I very recently went to an educational session and they talked about diabetes and the fact that diabetes now
Oh, really?
is number 3. Okay, so it's associated, dementia associated with sugar levels.
Okay.
You know, so those are the kinds of things that we discover ongoing, and that we know we can probably do something about that, because these are lifestyle diseases. Even though they may be in families, oftentimes it's the way we go about eating, how we've been accustomed to eating. Well, you know what? I get it, because we have a very short time. And
Right.
the part about this is I'm passionate about it because it's affected me personally.
Yes.
Right.
You know, I know about this. You know, I recently got diagnosed with diabetes. I was so shocked. I'm very passionate about all this. I really get it. You know, I think it's a blessing to age
Yes, it is.
and to age beautifully.
Yes,
You know, we have someone in our audience that's 95 years old, and
Yes.
it's wonderful. It's to, you know, the longer we can live, the better. But we want to be as healthy as possible.
Right.
Depression is one of the things that sets in sometimes as you start getting older.
Illness also.
Because loneliness and everything else, all those
Yeah.
things that challenges
Yes.
that we face. You know, but if we could begin to see that we have resources that we could reach out to somebody else, you know, that we can grow physically and spiritually, you know, all those things, you know, we'll just be a whole lot better off.
And I just want to thank you for
Thank
coming
you.
today.
Thank you so much.
Because the Black Nurses is a part of OWH Studios and Liberty Hall Studios. They're a part of us. Hello and welcome back to That Senior Show. Our special guest today is Miss Marshawn Harris, and she's an expert on Medicare. And that's something we should all know about, is Medicare. Because when you get to be 65 or before 65, you should know. Welcome.
Thank you for having me.
The question is, at what point, and if someone had told me at that time, and I don't remember now because it's been so long, at what point do you sign up for Medicare? Some people say 6 months, some say 3 months, some say 30 days before. Which one is it?
So really, you should actually start signing up 3 months prior to your birthday month. So you're eligible to enroll the first day of the month of your birthday month. So you're born in July, then you're eligible July 1st. So 3 months prior, you can actually enroll in Part A and Part B.
So you enroll in Part B, Part A, and Part B. Or
Well,
just
let's
if I'm still working.
Yes, let's clarify some things. So Part A is the hospital coverage, and that is free if you work 40 quarters, or usually that's 10 years, right? Then there is Part B, which you actually pay for. You would enroll in that if you aren't planning on working anymore, not planning on taking your company's insurance. You would enroll in Part B, that is the doctor's portions, anything outside of the hospital.
Okay.
And that's $144.60 per month. So sometimes you might want to delay if you're still working, right? Because you don't want to pay that extra fee when you don't have to. If you can have
Because
an
your company
employer,
is-
the
your
employer
company
pays
employ-
for it.
okay.
But as soon as you quit working or you're no longer going to take that employer coverage, you would want to quickly look into enrolling into Part A and Part B, definitely.
I have a question about Medicare, and And I think I'm going to take your question.
You ain't gonna do it. So what's the difference between Medicare and Medi-Cal, brother?
It's a common question because they sound very similar. So I always think of it as Medicare is going to be for people turning 65
Okay.
and for people who have been disabled for more than 24 months.
Okay.
Medi-Cal is for low income in California. Medi-Cal and Medicaid are the same thing, but in California we call it Medi-Cal.
I think I want to add it to the Part B, which is an option. And correct
Yes.
me if I'm wrong, that fee for Part B might be around 147, but you could also, by choice, have that taken directly out of your Social Security so that you don't have to come up with another fee.
Well, I mean, how you pay for it is up to you. Either you can have it deducted directly out of your Social Security check each month. If you want to pay by invoice, you'll have to pay quarterly. So that's 3 payments at one time. If you want to have a paper invoice sent to you, you know. So there's a couple things you can do, but at the end of the day, you must pay that. A lot of times people they feel like they've run out of funds and they decide they don't want to pay. But if you don't pay that, everything is going to fall apart because you're not going to have doctor's coverage and you can't have your supplements or Medicare Advantage plans either. So you just really need, if you need some assistance in paying that, the first thing you want to do is actually contact Social Security and ask for extra help to see if you qualify. You may qualify for some extra help or programs, but that is something you have to pay. And if you stop paying, you could actually pay a lifetime penalty.
Kind of like get embedded in the Social Security, but that may not be suitable for someone else. But I had to go and sit down and get educated. So that's what I'm asking you.
Well, there is many places you can go. The first thing, well, you could always use someone like myself.
Yes,
We don't
that's-
charge you anything. We receive a commission on the back end, right?
How we find you?
Well, for me, one,
Let me
you could
try
always
that.
just search, but for me personally, you can always, my office is Alpha Capital Insurance Services,
Okay.
and we're 589 Estadillo in San Leandro, California, and then my phone number is 510-682-4949. So you can find me.
Do you actually, I see a lot of other programs that are added on top of
Yes,
those.
yes.
Do you really need all those programs, and what is the benefit of having a program and the cost related? And all?
So do you need those programs? Do you need them? Quote unquote need? No. You do have, if you have Part A, Part B, you have your basic, what I said before, which is hospital and doctor. However, they will pay, Medicare in general pays 80%, and you would pay 20%. Well, that's not bad if you go to the doctor, but think about it if you come to the emergency room and you have to stay a night. 20% of $10,000 bill, that might not be in your wheelhouse. That's why you have a Medicare Advantage or a Medicare Supplement program.
John, we want to thank her for coming today and being a part of this panel. And I hope everyone got something out of this. And if you have questions, be sure and contact her. Her contact information will be at the end of the program. Her contact information will be there. And I just want to say we'll be right back.
All right.
Hello and welcome back to That Senior Show. Today we have a special guest and I'm going to let one of our co-hosts introduce him. I know him very well and respect him highly. Carla.
Oh, Bishop, it's an honor to be here for That Senior Show in another segment. Here with us, we have the infamous supervisor, Alameda County Supervisor Nate Miley, who has served the Oakland City Council for 10 years, and he served as supervisor for 20 years.
Yes.
And he represents like 250,000 seniors as an awesome senior advocate. Welcome to the show.
Thank you. It's a pleasure to be here today.
Yes,
Thank you.
for being here today. You have a question. I think we all have. But my thing is to recognize the seniors, and that's what I want Nate Miley to talk about today, is seniors. Because there's so many advantages to being a senior. And I think people should embrace it. I've learned to embrace it even though it doesn't embrace me. But I've learned to embrace it. But tell us what your view is on the seniors, and what are you doing to help seniors?
Yeah. Well, seniors are a passion of mine. I've been working with
older adults since 1986.
Wow.
And it didn't always start out that way. I didn't anticipate working with older adults that long, but I did. And started an organization called the United Seniors of Oakland and Alameda County. I'll talk a little bit more about that organization.
Yes.
But my approach to seniors is basically, if it's good for seniors, it's good for everybody.
It's good for everybody.
And if we
Yes.
and for young adults and young people, if they're blessed enough to live long enough to become a senior, we want them to have a good life too.
Yes.
So that's what it's all about.
That's what
Awesome.
I like that because my mother is 95 years old. She sits right outside, right in this studio today. And, you know, I've always, when I was a small kid in church, the seniors would be coming out of church and I'd always help them because we had a lot of stairs going up to the church. And I'd always go up and help them down to the last step. And that earned me a reputation at the church of always helping seniors. So when it came down to the senior show, the Lord gave me that senior show 15 years ago. And now it's in the full swing. It's come to fruition. It's for the seniors. Never thought I'd be one. I used to look at my grandfather and my grandmother. But I'm so glad to hear about the United. Tell us more about that.
Well, the United Seniors, I've got some material here, and I'll just kind of briefly go through some of it. Well, the United Seniors, I just want to say the mission of the organization started in 1986 to provide institutional support for seniors to collectively participate in the public arena, to act from a position of strength, to enable the elderly to address the critical issues and to change the conditions that impact their lives. So through the United Seniors, we don't provide services. What we do is we work to advocate on behalf of seniors. We work to empower seniors so they can advocate on themselves. So it's all about trying to push that agenda so that the quality of life for seniors is constantly being advanced, constantly being improved. You know, kids, I mean, everybody loves kids. Kids get a lot of attention,
Support.
a lot of resources,
Yes.
etc. But when it comes to seniors, we devalue seniors. We
Right.
devalue older adults. We don't have the type of
Yes.
respect for them.
Yes.
So our organization is constantly working to ensure that the voice of seniors are being heard.
And we rise to the top. You know, when I looked at the stats, 10,000 people per day become seniors in the United States.
That's right.
That's a lot of people.
And next year, it's going to be 40% of the vote, too, when it comes to the polls.
Yes, and besides, we control, seniors actually control a lot of money. Seniors control a lot of money. A lot of money.
I'm just asking, in what ways? Is that a
Investments.
secret?
No,
The
in
investments.
investments.
Okay.
And then
The
in wisdom,
stock
if you're
market.
smart.
Yeah.
The stock market.
Real estate.
Real estate. That's old money. They're trying to, right now, I was reading an article just 2 days ago, and the seniors that control so much real estate in the United States and in California, they control a lot of
Right.
it. And if they were to let it go, frankly, everybody wants to buy it, but nobody can afford it after a while. That's the problem.
Yeah. But let us not be mistaken, because that's often something that people assume, that all seniors are well off, they're retired, they got a good pension, this and that.
That's
No,
right.
there are
That's
a
not
number of
the
case.
seniors who are
Numbers,
right.
struggling,
They're struggling.
who are suffering or hurting.
Yes.
As a county supervisor, our role is to provide services to vulnerable populations, and we have a lot of seniors who are
Yes.
vulnerable, in need, and are
Yes.
struggling. And as we've all pointed out, the senior tsunami is here. It's upon
here.
us.
It's
There are
here.
more older
That's
adults, and there's constantly going to be more older adults. But the point is, some might be okay, but there are a lot who
A lot
need
that-
help.
Falling through
Well,
the
I
cracks.
think it's wonderful that we have you, that they have you as an advocate. And for those of us that aren't quite yet seniors, that do support and can step up, a lot of families don't have that
No,
type
they
of support. So it's great to know that your organization exists.
Yeah, well, thank
So
you.
what trends have you seen, and in what ways have you been able to tangibly support
Yeah.
seniors?
Well, let me say initially, when the United Seniors started in 1986, I was a younger man at that point in time.
We all were, okay?
All of us, yeah.
Fast forward, I've lived long enough that I've become a senior, and they made me the president of the organization. I had to earn that right. I had to earn that.
You paid your dues.
Yeah, right, exactly. They're not going to let just anybody be president.
No, you gotta have bad back and bad knees.
Even though I, started the organization, they said, okay, now you're worthy enough to be the president.
Badge of
So
honor.
exactly. So through the organization, we have programs that work on walkable neighborhoods for seniors. What's that? That's all about trying to make sure that communities are safe for seniors to get out and walk in. Because as I said, if it's good for seniors, it's good for anyone.
That's right.
And that keeps seniors active.
Yes.
It deals with sidewalks. It deals with dangerous conditions in
Yes.
communities. We just want to make sure that seniors and communities are safe for seniors and everyone to get out and enjoy the quality of life in
Yes.
those communities.
your
That's one
organization-
thing.
So your organization is a platform for empowering seniors.
Exactly,
Gotcha,
exactly,
gotcha,
exactly.
gotcha.
Then another thing we have is travel training. That is really important because we don't want seniors to be isolated. We want seniors to have a sense of mobility and
Yes.
have that freedom.
Yes.
And so
Yes.
through
And
travel
at that
training,
stage in their lives,
Yeah,
they have
e-
the mobility
exactly.
and freedom to travel.
you know, if seniors can't drive anymore and they're just stuck at home, that brings on depression.
It does.
So we want seniors to feel comfortable riding public transit. We want them to know how to ride public
Preventive
transit,
mental
to be
health.
to be accessible and to be safe. So through travel training, that's what we do. We acquaint seniors with AC Transit, BART, and other forms of public transit, and we encourage seniors to ride it, and we make sure that it's available, affordable, and accessible for them.
Is
So that's
this
another
like,
thing.
is this educational? Is this something where they meet with people? Like, how does that
Well,
message?
The way it works is there's a staff person who works on travel training, and she'll offer a 2-day class,
Clipper
and then there'll be a field trip. And the
Okay.
seniors get to go on a field trip. And normally it's anywhere from 5 to 10 seniors. And so we're constantly going out to senior facilities, senior residential facilities,
yes.
centers, et cetera,
See-
and organizing these travel training programs and courses so that seniors can take advantage of them.
Do you have,
like-
do you have a calendar of your events so that way seniors can get that class? So they can
they-
know what center to go to and what neighborhood and what area?
They would need to contact the office because the office will set up the travel trainings, and we can only do so many travel trainings, in a month's time. Because like if you're doing a 2-day course and then a field trip, you can't do that 4 weeks in a row. So there's got to be like a break and the reports that need to be done.
Right.
So we try to do maybe 2, 3 at the most a month. Train not just English speaking, Spanish speaking,
was gonna ask.
Vietnamese, any language we'll travel
That's
train.
great.
Awesome, that's great.
I think it's
good,
super
man.
important having that kind of personal touch and not just like a course that they read online, but actually someone they can meet with and have that kind of interaction.
Yeah,
Yeah.
well, the reason.
Then another thing is our medication management. We work with seniors so they're comfortable taking their medications, they know how to take medications, and they can safely dispose of medications. We're also involved with the 2020 census. It's important that
Oh, yes.
our
Stand up
vulnerable
and be counted.
populations get counted. We want everyone to get counted. So we've got a complete count effort going on for the 2020 census.
What about money?
Riley, your
Okay, so somebody
organization
else
seems to
can.
cover quite a bit of territory. So I'm wondering, do you have any liaising bodies of organizations or people that can also volunteer,
Oh, yes, for sure.
To
Contact
help
our office.
maximize your
Yes,
impact?
definitely. We're all, the staff, it's a small staff of about 4. I'm the president. We have a board and a leadership team of about 20 or so, and then we have a membership of about 13,000.
Are there regular meetings
Yes.
where people can participate?
Definitely. Regular meetings monthly.
Excellent.
Yes, and we have an annual convention that's coming up that we hold every year. It'll be coming up this year, and we'll be holding it in Castro Valley.
And this is wonderful because you cover 14 cities within the Bay Area counties.
Yes, yes.
And it's like San Francisco to, is it Pleasanton?
Well, San Francisco's in another county.
I mean,
but
Oakland, I'm
yeah.
sorry, Oakland to Pleasanton.
Yeah, Oakland to Pleasanton, Livermore, Dublin, Berkeley, Albany, et cetera, yeah.
That is
And
excellent.
another thing I just want to mention real fast is we work on affordable housing for seniors. And we want to make sure seniors can get housed.
so important.
And one of our big approaches is shared housing. And then we have a big Healthy Living Festival annually where we bring in seniors from all over the county. About 2,000 attend,
Whoa,
and they
that's
receive
nice.
resources, health fair, a free lunch. They take action on issues. They exercise. They hear entertainment. They socialize, and it's just a great day. It's a beautiful day.
You can count my mother in on that.
Can you expand a little bit on the shared housing piece?
Well, with the shared housing, when, let's say you own your property and you're no longer, you have it by yourself.
Yeah.
And you have, this
Underutilized space.
3-bedroom house and it's just you. So we try to match, if you're interested in that, we'll try to match you up with a senior who can come and share that living space with you for a reasonable,
Underutilized
rate.
spaces?
Yes.
Kind of like on an Airbnb for seniors.
Exactly. But there has to be a willing property owner, and then that person is matched with a senior that they feel comfortable with.
Do you have any stats on how many have been matched through the years?
We just started our shared housing program about 2 years ago, and working with other organizations. I think at the moment we might have matched our organization maybe, I would say couple of dozen, maybe, because it's really challenging to get those matches and also to get people
Right.
comfortable with wanting to share their house.
Sure.
For example, my mom lives back east. She's 88. She lives in a 4-bedroom house, 3.5 bath. Would she share that house? No, no,
Right.
no. She
Some
won't.
people
No,
enjoy their
no,
space.
No, exactly.
But in our metropolitan area where housing is such a crisis, it's wonderful to see that your organization is taking that on.
Yes.
Even if it's a small
Y-
sliver
yes,
of the
it's-
pie.
exactly.
Because every space counts.
Exactly.
And people need to know that if you have underutilized space, that they can partner with you
Yes,
and
yes.
make that happen.
Yes, because a lot of folks out here are unsheltered are African American, a lot are older adults, and a lot are male.
Yes.
Yeah. And maybe a female might not want to share a house with a male.
Right.
Yeah.
Correct.
What we're going to do, and we're going to continue this at another time, because I feel that Nate Miley has a lot to offer
Yes, he does.
to the
Yes.
senior program, and this is what it's about. This program is about informing seniors on how to live a good life, okay, the last of your life, the part that says twice a child,
Yes.
and you sometimes when kids are treated better than they
You want them to
Than
be
adult.
real golden years.
real golden years. And this is what we're going to do. And I want to thank you for coming today, and because thanking our panel and our co-host, because what we want to do is make it as easy as possible. Because I'll tell you something, seniors have paid their dues.
Yes, they have.
They paid their dues. Some of them have gone through World War II. I was born at the end of World War II. So my family worked in the shipyards. A lot of us came to California, and they worked in the shipyards and paid their dues. Some are still alive, and we want to make it as easy as possible. So that I'm glad all of this is being talked about in this senior show. And if you live to be a senior, and you're blessed to see it, I would say this is going to do you a lot of good, this program. It's going to be a weekly show, and we appreciate you coming, being a part of this senior show because it's important. And whether you're a senior or not, at this time, you need to pay attention, because if you live long enough and you're blessed to
You
get past,
will be
Right.
you
senior.
will be a
Right around
senior.
the corner.
Almost
And
everyone.
what's really special about what you just said, Bishop, is you mentioned the word shipyard. And I have to say that here locally, the superstar rock singer Sting is doing a production in San Francisco as we speak.
Really?
And it's an ode to his childhood and growing up in a city
That's right, he is.
where
Because
where
his
the
father was a shipbuilder.
shipbuilder.
That's what's up.
And so it's a whole production about his childhood and his ode to the seniors and the elders of that community.
That's what's up.
And we want to say thank you to everyone.
Thank you.
God bless everyone. And